Hello, I am Dr. Vijay Deshmukh, founder of Smilex, practicing dental implant for last 30 years and more. Every day we get a referral. Every day, possibly every day, someone sends an email, WhatsApp, and they ask, I done these implants. Can implant be repeated? Every day, possibly. And this is a new trend which is coming up because so many people are trying their hands at dental implants and they are failing and the patients are suffering. So it's very, very important when we get such a scan, we get such an email, we get such a telephone call. So we have to evaluate because we are doing dental implants for so many long years. A lot of my students, lot of my friends, they had problems with their cases and they do refer the cases to Smilex with lot of hopes. So what are the reasons that we have to do the repeat work? And believe me, repeat work is not a easy work. Any repeat work is not easy work. It's very difficult for the team, doctors, very difficult for the patient because you are suffering, you are undergone so much already, you are paid so much of money, you lost so much of time, money, energy in that, and then everything you have to do again. So, but still definitely there is hope. Now, what are the reasons for that we have to do the implant second time? What are the reasons by which we have to do the implant repeat work? The number one reason today is they had used an implant which has become loose, right? Implant has become loose because there are people whose success rate is very, very less. So there are many patients there are suffering. And if the implant has become loose, multiple implant has become loose, then they refer to us for going ahead with the second time implant. Second reason is peri-implantitis. There is a lot of infection around the implant. So implant has a lot of infection, gum infection, and the patient is in pain. This is the second reason. Third reason what we see is the fracture of the implant. We do see cheaper implant getting fractured exactly at the neck, many times in the center, right? And this fracture implant we have to take completely out, do the regenerative procedure, graft it, and then we have to go and form more better quality bone and then place the implant. Then we also get patients to do repeat work where the implant has been placed very wrongly, and now the implant is positioned so wrongly that it is most difficult to make a prosthesis on that. Then those implant we have to take out completely. Also there are situation patients do send us scans internationally also because that brand of implant is no more in service now, right? So implant has been done 25 years before and now that brand is not serviced. So sometimes such implant also we have to do care. So we have to remove these implants, graft it, or if there is a good quality bone, then we can go for a wider choice of implant. So we assume that repeat work is not an easy work. Repeat work for you is also very taxing because you have to again pay little more than what you had paid before, because now rehabilitation becomes complex because we are now have to first regenerate the bone and then go for implant placement. We have to look for areas where there is still a primary bone, good quality bone, and place the implant. So it is very important that you make the first choice a wiser choice when you are undergoing dental implant, and that choice will make it a very good choice for longevity of your implant. So at Smilex we do definitely gets a lot of emails for repeat work, and we do try to help the most of the patient by a scientific way. Whatever technically and scientifically we can give, we can definitely try to help this patient. So yes, repeat work is possible, and we do routinely at Smilex. Thank you for watching Smilex.